An Arkansas woman elects to spend tens of thousands of dollars for a surgery after her insurance company refuses to pay for it. Channel 7's Jason Peterson joins us with a look at a situation that has been frustrating for both the patient and the doctor.
Yeah, it has. And if Sunni Ackley would agree to endure another open heart surgery, her insurance company would pay for it. Medical research has created, though, a cheaper, less invasive option that is now available in Arkansas. But Sunni's insurance company says it's not an option for her. 2 weeks after surgery, Sunni Ackley is already feeling like her old self.
That next day when I got home, I could automatically feel a difference in my body. I told my mom it felt like my skin was crawling because I had all this new energy that I hadn't had in so long.
Sunni was born with a defective heart. She had her first heart surgery shortly after birth. Her second was at age 12, and her new pulmonary valve, taken from a cow, performed well for over a decade. But several years ago, she noticed a drop in energy. Last year, she wasn't able to play softball for the first time since preschool. Another surgery was going to be necessary.
These artificial valves just aren't meant to last forever. And so Sunni had reached a point where her pulmonary valve that was in place was no longer functional for her.
I've already had 2 open heart surgeries, so there was a lot of risk going back in and cutting me back open because of all the scar tissue and just the risk of open heart surgery it's a big procedure.
I'll see you in a couple hours.
I'll be there.
Right.
6 months ago, Arkansas Children's Hospital performed a new procedure on a heart patient called a melody valve replacement.
So this is what we're talking about. This is a melody valve here. It's a cow valve. It's mounted inside of a stent, this little wire mesh cage here.
The device enters through an artery in the leg and is guided by cameras up to the patient's heart. This is video from Sunni's surgery. Dr. Antuaco uses video monitors to get the melody valve in place before it is inflated and the catheter is removed.
So most patients, I think, would choose to go the less invasive route, even if it would cost them more. But with it costing actually less and being less invasive, I think there's a clear advantage to this approach for the patients who qualify for it.
According to Sunni's insurance company, she does not qualify for it, or at least United Healthcare wasn't willing to pay for it. One of several denial letters states that there is not enough medical evidence that the valve replacement device is helpful to improve your valve disorder. So this valve replacement device is not proven to help your condition.
It's easy to say, well, this is an experimental thing. This is not experimental. This is an approved device. This is an approved use for it by the FDA.
Dr. Antuaco says he has performed the surgery 8 times, and Sunni's is the only case where insurance did not cover the procedure.
So it's been a frustrating process, I think, for all of us, because we would have liked to have had this approved for Sunni. She just wouldn't have to go through the process of fundraising and paying for this out of pocket.
It's frustrating when you pay in each month. I pay my premiums, I pay my deductibles, and then I can't use my insurance. I just don't think that's fair.
Now, Sunni and her family had to put $12,000 down and are now working to raise the rest of the $69,000 that her surgery cost. Now, late today, we did receive a written statement from United Healthcare after Sunni signed a waiver allowing the company to discuss her case. It states in part that her benefit plan excludes experimental or unproven services and that the melody valve falls into that category because there is only limited published evidence of safety and long-term effectiveness. You can read United Healthcare's entire statement later this evening by clicking on this story at KATV.com. Now, Sunni says she and 7 others here in Arkansas are living proof that this procedure works, and she hopes that other heart patients in the future will be covered by this insurance company and others.
And as the doctor said, it's FDA approved.
That's right.
Yeah, frustrating. All right, thanks, Jason.